For our advocacy project, we decided to focus on violence within schools and how it relates to education and students with disabilities. Violence in schools has been a long-term problem that has caused many more issues than just the obvious related to violence. Schools aim to be a safe place for students, faculty, and staff. However, many times students that show violent behavior or are exposed to violent behavior do not continue to receive the proper education that is needed. Schools need to use behavior management techniques to prevent violence in schools. By promoting a safe, supportive environment and encouraging students to take part in keeping their school a safe place, we can guarantee that students can stay in school and receive the same education as their peer.
According to Suzanne Perkins, violence-exposed children have an increased risk of developing school-related problems, including mental health problems, learning disabilities, language impairments, and other neurocognitive problems. These problems interact to create a complex web of deficits and disabilities where intervention access points are difficult to assess. Often, mental health problems and academic problems develop in parallel. Timing of violence exposure and the developmental stage of the child during exposure complicate our understanding of the underlying mechanism. Different types of violence exposure have different outcomes for children that are exposed to it.
Learning Disabilities Association of America strongly supports efforts to eliminate violence in American schools. It is a popular consensus that students who show violent behavior that pose a threat to themselves or others should be taken out of their current school setting. This will help keep the school a safe place for the rest of the students. There is also a law in place that makes sure that even students with disabilities that are removed from their school gain the access to free public education. There is a misconception that students with disabilities are responsible for a large majority of violent behavior within schools. This, however, is not the case. The U.S. Department of Education reports that schools that have acted early with techniques to prevent school violence and have implemented these models effectively have greatly reduced or eliminated entirely the need for subsequent interventions.
In summation, schools can prevent some mental health problems that develop and occur later in life from violence exposure by promoting a safe school environment. This also can ensure that more students have access to a normal education just as their peers receive. Also, students that show violent behavior, whether they have a disability or not, should still receive a proper education. By practicing these ideas, we can make sure that fewer students are exposed to violence and every student can gain the best education possible.